Our digestive system plays a huge role in managing what enters and exits our bodies. Despite how complex these organs can be, there are simple ways to take care of them. We get advice from gastroenterologist Dr. Luis Abola. Doc, thank you so much for joining us. How important is our digestive system?
Okay, so good evening and thank you for having me. Of course, anything that we eat, for nutrition, we will die if we're not able to eat or drink water. So whatever we eat is broken down so that it can be absorbed. And then the excess, of course, is excreted out. So it's digestion, absorption, and excretion. And of course, if we cannot eat, we will die in a few days.
Oh my goodness, that we don't want to happen. What about ulcer? How does one get it and how do you manage it, Doc?
Okay, so ulcers, it's really a balance between what we call protective and aggressive factors. Protective factors would be blood supply to the stomach. Then you have a normal mucus layer that protects the stomach, the stomach mucus, the lining. Then aggressive factors will be some medicines that may injure the stomach or duodenum, bacteria called Helicobacter bacteria, and anything that will deprive or lessen the mucus layer. So if that happens, you develop, it can be a gastritis or just minor erosions, and then you have an ulcer itself. And the most common, if it's in the duodenum, would be the Helicobacter pylori, it's a bacteria. You get this if sometimes if you have someone in the household who's infected with it also, you can get it from them. So it's from the saliva of the person. Then some medicines will cause also gastric ulcers.
Okay.
And some people are just prone to develop this one.
What about appendicitis? What is the cause of this?
Appendix, the appendix is in the right lower area of our abdomen, and it has a small opening, and sometimes a stool, fecal material, we call this a fecalith, can obstruct. And then when it obstructs, there's inflammation. And there's inflammation, the body tries to protect it. So that's why you will have pain in that right, I call it the right lower quadrant of your abdomen.
Yeah.
And yes.
And of course, the fear of many people is to get colon cancer. How does one get it, Doc?
Colon cancer can be hereditary. That's why we encourage people who have parents, siblings, or immediate family who have colon cancer to undergo colon cancer screening on a very regular basis. Of course, age is a risk factor, so we recommend also everyone now younger age of 45 years old to undergo colon cancer screening. How can we avoid it? Good diet, high fiber diet, less processed meat. Then smoking also may be a risk factor. Colon cancer is, I think, third or fourth most common. And just to tell you, last month, I think we did a lot of colonoscopies in our university, and probably 20 to 30% we had colon cancers in the patients that we did our colonoscopy.
So Doc,
it's still very common in the Philippines.
Common in the Philippines, indeed. And how often then should we see a doctor to check our digestive system?
Well, if you're still young, if you're not symptomatic, probably once a year would be good to have your annual physical examination, executive checkup. Then if you're but unless you have a family history, then when you turn 45, best to have a colonoscopy. Then probably a yearly, what we call fecal occult blood test. So it's a stool exam that determines the presence of blood, even if your stool appears normal. Then probably yearly. Then of course, it depends on what we see in the colonoscopy. We'll give you the interval when the next follow-up will be. Then, of course, if you have symptoms.
Doc, thank you so much for your medical advice for those who are having issues with their digestive system. Gastroenterologist Dr. Luis Abola. And you get more health tips on MedTalk Health Talk, hosted by Dr. Freddy Gomez, with new episodes every Tuesday at 8 in the evening.